Hi everyone. Today in this video let us discuss hydrocortisone. What is this drug hydrocortisone? Hydrocortisone is one of the natural glucocorticoid which acts as anti-inflammatory agent. This drug can be given by topical route in form of ointment, cream, lotion to treat inflammatory skin disorders. Even this drug is available as tablet form and injection form for treating systemic inflammatory disorders. But today in this video we are going to see how this hydrocortisone is used by topical route. So small insects, dust mites or allergens, when they fall on the skin they produce some inflammatory reactions. So these foreign particles can stimulate the immune response which produces the inflammation. Due to the stimulation of T cells, inflammation on the skin is going to be increased, resulting in the redness of the skin, increased swelling affecting the different parts of the body. So this tenderness, redness, swelling, all these can lead to increased itching response which can be treated by hydrocortisone applied on topical route. So today in this video we are going to see how this hydrocortisone acts, what are the important precautions, side effects, and what is its chemical nature. All these things we will discuss in this video. First of all, let us see the chemical nature of this drug. So this is the structure of hydrocortisone. We can simply see that it is not having an extra double bond within the ring. So this is having the pregnane nucleus, so pregnane 4-ene 320 dione. 3 hydroxyl groups are present which can be written as 11 beta 17 21 trihydroxy. So that is the hydrocortisone, and this hydrocortisone can be modified to the ester form, particularly at this hydroxyl group where it can form the ester with butyric acid so that it can form hydrocortisone butyrate. In addition, this hydroxyl group can also be esterified with propionic acid so that it produces another ester probutate, where propionate and butate are present within the structure. So it's a diester forming with propionic acid and butyric acid. In this way, hydrocortisone is available as hydrocortisone butyrate as well as hydrocortisone probutate. Now let us see how this drug acts. One of the important action of hydrocortisone is on the immune response. So hydrocortisone can enter into the cells and it can bind to the one of the receptor, glucocorticoid receptor. These glucocorticoid receptors are present in the cytoplasm along with one of the protein HSP90, heat shock protein 90. When hydrocortisone binds to glucocorticoid receptors, they can interact with the DNA within the nucleus. Now hydrocortisone can bind to these receptors which is going to be activated. Immediately it can be internalized into the nucleus where heat shock protein is separated and glucocorticoid receptors are dimerized which interacts with the DNA to produce the gene transcription. So by this they can prepare the mRNA. This mRNA can code for the various anti-inflammatory agents. Now this mRNA can undergo the protein synthesis within the ribosomes where it is going to release few of the mediators such as lipocortin 1 and annexin A1. These mediators can control the inflammatory cascade, thereby they can reduce the inflammation. Similarly, hydrocortisone can also reduce the activation of IL-2, which is one of the cytokine that increase the immune response. In this way, hydrocortisone can also reduce the immune response, thereby it can reduce the inflammatory cascade. And few of the inflammatory mediators can act on their corresponding receptors which are located on the cell membrane. So when these inflammatory mediators are acting on their receptors, they can stimulate few of the pathways such as NFKB, nuclear factor kappa B. This nuclear factor can enter into the nucleus and interact with DNA where it is going to stimulate gene transcription so that it can release so many types of inflammatory mediators. Now again, hydrocortisone can control this inflammation. When this binds to glucocorticoid receptor, it can enter into the nucleus and it can inhibit the NFKB pathway. So by inhibition of this pathway, it can reduce the release of inflammatory mediators. By all of these actions, hydrocortisone can control the immune response. Similarly, when there is an inflammatory stimuli within the cell, it can stimulate one of the enzyme phospholipase A2. This phospholipase A2 is a membrane cleavage enzyme. It can act on the phospholipids on the membrane such that it can cleave and produce another component, arachidonic acid. This arachidonic acid is a C20 fatty acid which can be converted into various mediators by one of the enzyme COX enzyme, cyclooxygenase enzyme. Now, by action of this enzyme, arachidonic acid is going to be converted into various mediators such as PGE2, PGI2, thromboxane A2. In this way, prostaglandins, thromboxanes are going to be produced. All these can produce some inflammation resulting in the redness, itching, and swelling of the skin. Now, hydrocortisone can release one of the mediator, annexin A1, which can bind to the phospholipase A2 and can inhibit activity. Similarly, hydrocortisone can also control the COX pathway so that inflammatory mediators are somewhat less released. By all of these actions, hydrocortisone can control the local inflammatory action. In this way, hydrocortisone acts as anti-inflammatory agent which can be applied topically on the skin. Now let us see the precautions of hydrocortisone. One of the important precautions of hydrocortisone is that it can produce some local skin reactions such as skin irritation. So it can produce some burning, stinging sensation. Particularly when it is going to be applied on broken skin, it can increase the skin irritation. And this drug cannot reduce the viral as well as bacterial infections of the skin. So this drug mainly reduces the inflammatory response. In order to reduce these bacterial and viral infections, antibiotics and antiviral should be used along with this hydrocortisone. Hydrocortisone can suppress the HPA axis, hypothalamus, pituitary and adrenal axis so that the release of cortisol is somewhat reduced. So it can produce the adrenal insufficiency which is somewhat reversible. So by stopping of this hydrocortisone usage, HPA axis can be restored, and the suppression of HPA axis is observed with increased dose and frequency of usage. So on frequent usage for long term, hydrocortisone can suppress the HPA axis. What are the side effects? Most of the side effects of hydrocortisone by topical route are the local reactions. It can produce some skin rashes, skin irritation, burning sensation, stinging, and contact dermatitis can be produced by this hydrocortisone. So when these reactions are more pronounced, then this drug should not be used. How it is given? This drug is available in the form of ointment, cream, lotion for topical purpose, and this should be applied 2 to 3 times on the intact skin where inflammatory response is observed, but it should not be applied on the broken skin in order to avoid severe skin irritation and burning. So that's about this drug hydrocortisone, which is given by topical route, which is a natural glucocorticoid. This drug reduces the inflammation by reducing the immune response, and it can also reduce the local inflammation by inhibiting the COX pathway and phospholipase A2 pathway. So that's about this drug hydrocortisone. Hope you have enjoyed this video. If you like this video, please subscribe to our channel, share this video with your friends, post your comments in the comment box. Thank you for watching this video.